This video is about how to reduce your risk for colorectal cancer and screening. This video was created by the Office of Community Outreach and Engagement at the Herbert Irving Comprehensive Cancer Center. Did you know that colon cancer is preventable if the polyps, which are growths in the intestine that start out being harmless and can turn into cancer, are removed? Colon cancer is the third leading cause of cancer deaths in the U.S. and among New Yorkers. Screening tests can help find and remove polyps, preventing colon cancer, and find colon cancer early when treatment works best. The colon and the rectum are part of the digestive system. The colon is a 5 to 6 foot long tube and is also called the large bowel or large intestine. Food is digested in the stomach and small intestine, then moves to the colon. The colon absorbs water and moves the waste into the rectum. Colon cancer is a type of cancer that begins in the large intestine or colon. Rectal cancer begins in the rectum. Colon cancer usually begins as small clumps of harmless cells called polyps. Over time, some of these polyps can become colon cancers. There are things you can do to reduce your colorectal cancer risk. You can be physically active, eat fiber and dairy, have any polyps removed, and talk to your doctor about available medications. There are also things that you can avoid doing, like drinking alcohol or eating red or processed meat. You can avoid smoking and also becoming overweight. Between the ages of 45 and 75, both men and women at average risk for colorectal cancer should be screened using either stool-based tests, which are done every year, or colonoscopy, which is done every 10 years. Men and women at high risk often start screening earlier and screen more often. This includes those with a family or personal history of colon cancer, persons that have had previous colon polyps, or ones who have inherited genes that are known to cause colorectal cancer. There are different kinds of take-home tests: the FIT, the FOBT, and Cologuard. FIT and FOBT look for hidden blood in the stool. Cologuard looks for hidden blood and colorectal cancer DNA in the stool. When you are given a kit, you will receive instructions on how to collect the sample and will get answers to your questions. If a fecal test results are abnormal, the doctor will ask for further testing, usually a colonoscopy. Colonoscopy screening is the examination of the full length of the colon and rectum. While under anesthesia, a long, flexible tube that has a light and camera at the tip is inserted in the rectum. This is used to diagnose problems in the colon and rectum and to perform biopsies and remove colon polyps. During the colonoscopy, the doctor looks for cancer and polyps throughout the entire colon. Any polyps found are removed and tested to see if they may be turning into cancer. If the results are normal, the colonoscopy may be done once every 10 years. Otherwise, the doctor will decide when the next colonoscopy is needed. Remember, colon cancer can be prevented. All men and women 45 years and older should be screened. Talk to your doctor about which test is right for you. You can lower your risk of developing colon cancer. There are colorectal cancer screening resources available to you. For people without health insurance, the Manhattan Cancer Services Program at New York Presbyterian Columbia University can be called. You can call 212-851-4516 for an appointment. For people with health insurance, they can be seen at the New York Presbyterian Columbia University Irving Medical Center for Digestive Health. The telephone number is 212-342-1155. For more information, scan this code with the camera app on your phone.